Well, hey guys, this is Dr. Sean over at Fortis. It is week 6. It's the end of the term, so congratulations on this. I'm just kind of lounging today on a nice afternoon or morning. I think it's morning. I don't know. I've been just kind of loofing around. It's a Sunday morning, and we're getting ready to start week 6. And week 6, as you can see, is right up here. Okay, so we have the overview. I'm going to show you a couple things on that overview. The marvel of the of creation and reproduction. That's nice. Learning outcomes. There's the textbook table of contents, reproductive system for the male and the female, knowledge check, which I went over in the dry run or the speed run of that one. Abdominal pain, we talked about that too, male and female case studies, and there's a final exam. So just really quickly, I'm going to show you some stuff on the final exam. Shuffle answers, no, it's going to keep the same answers all the time. It doesn't give you any, let's see. Assignment groups, time limit 100 minutes for 100 points. That's pretty fast. That's a fast test, so take it as quick as you can. You got the information, you know the information, but let's go through real quick. Extreme constipation is an extreme constipation and intestinal obstruction is obstipation, so it's a similar thing. Melena is actually like blood in the poop, I believe it is. Hematochezia, same kind of thing. Dyspepsia is poor or bad. What's it called? Bad digestion. Dyspepsia is like reflux. Go to the next one. It doesn't give you a lot of time on this, does it? Tying off a blood vessel or duct is called a ligation, tubal ligation. That would be the term for getting your tubes tied in reproductive, actually. I'm going to go through a few of these just to see what happens here. The sphincter between the stomach and the first part of the small intestine is the pyloric, or the ileocecal valve, or the ileocecal sphincter is way down at the bottom. The IES, ileoesophageal sphincter, I think, and ileocecal one, we talk pyloric, pylorus, that goes down to the stomach, and cardiac is the top one, actually. These are going to be the same thing, right? An endoscope is an instrument to visualize the inside of the body. Yeah, it's because endo, inside, and scope means to look inside, right? Pyorrhea, pyo means pus, and rhea means to flow. So often seen in gingivitis, can be in gingivitis, can be in many different conditions. Oh, I hate these ones. Here we are. What is the abbreviation for the disorder characterized by the inflammation of the lining of the intestine, bleeding, and diarrhea? We're going to put IBS. Irritable bowel syndrome. That's what I'm putting. Anyway. Okay, inflammation of the kidney is itis. Oh, look, we have all itises in there, so that's bad. Trigon, that's down in the bladder, right? Cyst is the bladder. Neuritis is nerve, and nephritis is actually the kidney. The nephrosis. Nephrosis and nephritis are very similar. Nephritis is inflammation. Nephrosis is condition of. Remember the nephron, the glomerulus, those are all main points. The nephron is the functional unit of the kidney, right? Remember that. We're only going to do 5 minutes, so I'm going to get as many as I can. I only get about 10 of these, okay? Condition of stones in the urinary tract is called lith. Lith is the word for stones. UTI is urinary tract infection. Renal colic. Ooh, that could be because that would hurt. Colic is pain from the kidneys. Polycystic kidney disease. No, those are cysts. So it's urinary system. Okay, lith. Lith means stones. Like monolith is one big stone, right? Go down through here. Scanty urination. Oliguria is that one. Dysuria is pain or difficulty. Nocturia is nighttime peeing. Bilateral renal cysts, reducing the function of the renal tissue, are known as polycystic. Polycystic. Poly means many, right? Cysts or cysts, and kidney disease. There we go. I'm saying that one. Let's go one or two more just for giggles. What happened? Okay. An abnormal group of symptoms in the kidney characterized by proteinuria, hypoalbuminemia, and edema. Wow. I'm going to say nephrosis. You have to look that one up. There you go. You get a chance to look it up. Anyway, that's about 5 minutes. I just wanted to go through the first, verse 11 questions of the test. I want you guys to know you did really well in the class. All the grades look really, really good for this term. As I'm thinking of you guys, and went through the discussions. Remember that everything is due by Friday night, midnight, or Saturday at 1:59 a.m. or whatever the heck it is. I put grade-ins on Saturday, and the reports have to go in after that. And so there's no way to change anything after it's due. So make sure you get stuff due. If you're having a problem, make sure to email me or contact me on Canvas. We can set something up or get something kind of done for that kind of thing. My camera seems to be wonky. It seems like it's fading that way, but it's facing me. I have a problem here or whatever. Anyway, I hope you guys do well. Congratulations on completing the class, really. And good luck in the next thing you do. You know, you got this. You're well on your way. You finished this whole thing and you did it very easily. It wasn't that hard, was it? It was a pain in the butt sometimes, but it wasn't too hard. This is Dr. Sean over at Fortis, and this is medical terminology. Talk to you guys later. Take care. This is for all you guys. Good luck. Bye.